There are several factors that can increase your risk of developing leukemia. These factors could range from your genetics to diet and more. Here are some factors that increase your risk of leukemia. World Leukemia Day is observed on September 4th every year. The day aims to raise awareness about leukemia and other blood cancers. Leukemia is a group of cancers that affect the blood-forming tissues, such as the bone marrow. There is no one cause of leukemia. However, there are several factors that can increase your risk of developing the disease. These factors significantly affect whether you'll develop the disease, and these could range from your genetics to diet and more. Here are some factors that increase your risk of leukemia. A family history of leukemia or other inherited genetic disorders such as Down syndrome can increase your risk. These conditions affect how cells grow and divide, which makes them more prone to mutations. While anyone can develop leukemia, there are certain types of the disease that are more commonly seen in older adults. For example, acute myeloid leukemia (AML) is more frequent in people over 60. Also, men have a higher chance of developing leukemia. High doses of radiation, such as those from nuclear accidents or excessive medical imaging, can damage the DNA. This cellular damage increases the chances of abnormal growth of blood cells, which eventually leads to leukemia. Benzene is a chemical that is found in industrial solvents, paints, and pesticides, and it is a known risk factor. Prolonged or heavy exposure to such toxic substances can harm bone marrow and affect the production of blood cells. Tobacco contains carcinogens that enter the bloodstream, which can eventually cause blood cancers. Similarly, excessive alcohol can weaken your immunity and harm the bone marrow, thereby increasing the risk of developing leukemia. People with compromised immunity due to HIV, organ transplants, or prolonged use of immunosuppressant drugs are more vulnerable. A weaker immune system might find it difficult to control the growth of abnormal cells. People who have undergone chemotherapy or radiation for other cancers have a higher risk of secondary cancers like leukemia. The treatments that destroy cancer cells can sometimes damage healthy blood cells. Disclaimer: tips and suggestions mentioned in the article are for general information purposes only and should not be construed as professional medical advice. Always consult your doctor or a dietitian before starting any fitness program or making any changes to your diet. Also, read colon cancer symptoms (AIMS). Harvard doctor highlights key warning signs.